Hello everybody, welcome to our new module on aortic regurgitation. Let's begin with the introduction. Aortic regurgitation is the leaking of blood from the aorta to the left ventricle during ventricular diastole, such that the heart has to pump harder due to the extra amount of the blood that has regurgitated from the aorta to the left ventricle. Most common cause of the aortic regurgitation is aortic root dilation, which is idiopathic in most of the cases. So, while talking about the causes of aortic regurgitation, one of the causes is congenital aortic bicuspid valve, and there are many acquired causes of aortic regurgitation. The most common ones are rheumatic heart disease, infective endocarditis, and as you may know, these two diseases affects the valve of the heart, and even trauma can cause aortic regurgitation, and basically any condition that dilates aortic root can cause aortic regurgitation. Those conditions are aortic aneurysm, aortic dissection, syphilis, ankylosing spondylitis, and even drugs can cause aortic regurgitation. The drugs like fenfluramine, which is an anti-epileptic drug, and dopamine agonist. Drugs like bromocriptine can cause aortic regurgitation. Other causes are Behçet's disease, SLE, osteogenesis imperfecta. These all conditions can cause aortic regurgitation. So there are many signs of the aortic regurgitation, and to understand those signs we have to know the pathophysiology of aortic regurgitation. So what happens in aortic regurgitation is that extra amount of the blood leaks into the left ventricle. So the left ventricle dilates and undergoes hypertrophy, and due to the leaking of the blood, the stroke volume of the heart doubles, even trebles sometimes, and this doubling and trebling of the stroke volume makes the major arteries pulsatile. For example, we can see the prominent carotid pulsation in the patient with the aortic regurgitation. So as the aortic regurgitation progresses, left ventricular diastolic pressure rises and the patient starts having shortness of breath and the other symptoms of left heart failure. And this is the drawing showing the leaking aortic valve, and due to the leaking of the blood, the left ventricle will undergo hypertrophy, and eventually the left ventricle will become stiff such that it cannot pump any extra blood, and the patient may have heart failure. So if the aortic regurgitation is mild to moderate, the patients are generally asymptomatic, but they do have palpitations. Palpitation is the subjective awareness of the heartbeat, and if the aortic regurgitation is severe, the patient starts having the symptoms of left heart failure like shortness of breath, angina pectoris, paroxysmal nocturnal dyspnea, and orthopnea. Orthopnea is the shortness of breath that the patient have while the patient lie down from the sitting up position, and paroxysmal nocturnal dyspnea is the condition in which the patient wakes up at middle of the night due to the shortness of breath. The patient wakes up and goes to the window and opens the window in the hope to get some air. And there are many signs of aortic regurgitation which is seen in the patient with aortic regurgitation. So let's start talking about the signs of aortic regurgitation. So one of the signs of the aortic regurgitation is large volume collapsing pulse, which is also called water hammer pulse or Corrigan pulse. If you see this drawing, the normal pulse is like this, and in aortic regurgitation, due to the high stroke volume, the pulse is upstroking, and it falls down so quickly, so steeply. This is called collapsing pulse or water hammer pulse, and the patient have very low diastolic pressure and high pulse pressure, and due to the large stroke volume, the patient may have dancing or bounding peripheral pulses. We can see the pulsation on nail bed, that is called Quincke sign. We can see pulsation on uvula, earlobes, and we can hear femoral bruits on auscultation on the femoral artery, that can be heard as pistol shot sound, and this is called Rosie's sign. And the patient with severe aortic regurgitation may nod their head with each pulse, that's called D Mosset sign. And we can even see visible pulsation on the abdominal aorta, and in some patients we can see prominent carotid pulsation, that's called Corrigan sign. And if we measure the systolic blood pressure difference between brachial and femoral artery, that would be greater than 20 mm of Hg. I have some of the videos of signs of aortic regurgitation in the next slides. So this is the Quincke sign. I will play this video for you. Try to appreciate the blanching and reddening of the nail bed. Now I am going to play this video for you. Try to appreciate the reddening and blanching of the nail bed during its stole. Hopefully you appreciated the reddening and blanching of the nail bed during its stole. And this is the Corrigan sign. I will play this video for you. This sign is characterized by prominent carotid pulsation, hopefully you can appreciate the prominent carotid pulsation. And if this is associated with head nodding, this is called D Mosset sign. And this again is the Corrigan sign. I will play this video for you. Hopefully you can appreciate the prominent carotid pulsation. So the main physiologic basis of all this sign is the increased stroke volume, early decrescendo diastolic murmur, which is best heard in the right sternal border, and you can even hear ejection systolic murmur, which is due to the increased stroke volume. And in some patients we can hear Austin Flint murmur, that is the mid diastolic murmur of mitral stenosis. It happens that the regurgitated blood can potentially cause mitral stenosis, and this murmur may be heard. And there are other signs that can be seen in the patient with aortic regurgitation. One can feel the apex beat, that is down depressed and it is heaving. And in the later case of aortic regurgitation, we can hear S4 sound. This sound is heard due to the steep left ventricle as the left atrium tries to pump the blood through the steep left ventricle. We can even hear crepitation due to the venous congestion in the lungs. ECG shows the increased left ventricular voltage, tall R waves in B6 and deep S wave in AB1. On X-ray, we can see enlarged left ventricle and dilated ascending aorta. And finally, let's talk about the management of aortic regurgitation. Some of the drugs like calcium channel blocker and ACE inhibitors, these are proved to improve the left ventricular function in the patient with aortic regurgitation, the main goal is to decrease the afterload. And the mainstay treatment of the aortic regurgitation is obviously aortic valve replacement. Repair is not feasible in rheumatic heart disease.